What if the key to preventing and surviving cancer isn't just found in a hospital, but in how you sleep, eat, move, connect, and live every day? My guest today is Dr. Lorenzo Cohen, Director of the Integrative Medicine Program at MD Cancer. Take two. My guest today is Dr. Lorenzo Cohen, Director of the Integrative Medicine Program at MD Anderson. Take three. My guest today is Dr. Lorenzo Cohen, Director of the Integrative Medicine Program at MD Anderson Cancer Center, one of the world's most prestigious cancer institutions, where he spent nearly 30 years pioneering a field called Integrative Oncology. With a PhD in medical psychology and deep roots in behavioral science, Lorenzo has dedicated his career to blending the best of conventional cancer care with evidence-based mind-body practices, lifestyle interventions, and emerging therapies like Biofield research. He's also the co-author of Anti-Cancer Living, a practical guide built around what he calls the mix of six lifestyle pillars that can meaningfully reduce your cancer risk. I'm host Aaron Strout, and this is a conversation that could genuinely change how you think about your health. Let's reach higher with Dr. Lorenzo Cohen. Well, Dr. Cohen, I am thrilled to have you joining me on the show today.
Well, thank you. Thanks for having me. And please call me Lorenzo, and looking forward to this conversation.
Great. Well, I will. I always like to be respectful. I know you earned your degree. But anyway, one of the things I like to do with all of my guests, I always like to get their origin story, right? So how did you get here? And so for you, I'd love to know what led you down the path to where you ended up. And then maybe while you're at it, you could talk a little bit about this very important topic we're going to cover today called integrative medicine, since it seems to be such an important aspect of your career.
So, we don't have time for my full origin story, which actually dates back to exposure with my grandmother, who was a yoga master. So I guess you could say from birth, I was kind of exposed to Eastern philosophies and practices. But my background and training is as a behavioral scientist. I have a PhD in medical psychology with a particular focus in an area called psychoneuroimmunology, trying to understand how emotions, behaviors impact our biology and therefore influencing outcomes. And back in 2002, I joined MD Anderson in 1998, so almost 30 years I've been at MD Anderson, which is a cancer center in Houston, Texas. In 2002, we founded our Integrative Medicine Center, or Center for Integrative Oncology, and was asked to lead it. So I went from being more of a card-carrying behavioral scientist looking at psychological and behavioral interventions to have to learn about natural products and phase 1 clinical trials and acupuncture and Chinese medicine. So it was a very steep learning curve. Aspects of this field of integrative medicine, which is applied more generally, and within cancer, we call the field integrative oncology, because the focus is specifically on supporting patients with cancer. So what is integrative oncology? And I'll kind of read you the textbook definition that we came up with, that was published a number of years ago. Very importantly, it's patient-centered, evidence-informed field of cancer care and support that would utilize mind and body practices, natural products, and very importantly, lifestyle modifications. And this could be from different traditions, but most importantly, alongside conventional cancer treatments. And the goal is really to optimize a patient's health, their overall quality of life, ultimately their clinical outcomes. And this can take place anywhere across the cancer care continuum, ideally to prevent cancer in the first place. And there's a role for lifestyle and prevention. And then, across survivorship, palliative care. And the key is to really empower people to prevent cancer and to become active participants, both before, during, and then after diagnosis and treatment.
Well, it makes sense. And I like the approach of we're going to take the best of all of the different solutions and in a clinical, approved way, we're going to bring them forward. And I know we'll get into that. I do want to talk a little bit about the fact that while you are at one of the most prestigious institutions, in the world, especially when it comes to cancer care, you mentioned this. You've been there for 28 years, which is a long time for anybody. But like, what's kept you at MD Anderson for all this time?
Um, Lack of inertia? No, actually, I've looked around over the decades, and it's just an incredible place to work. First and foremost, it's my let's call them my conventional oncology colleagues are so supportive of what we're doing in integrative medicine. There was never what you would kind of expect of skepticism in what we're doing. And that's partly because everything that we've done within integrative oncology at MD Anderson has either been embedded in the evidence. We only provide evidence-based, guideline-approved modalities to patients. And most importantly, we do research, and we have a lot of funding from the NCI and foundations. So where there isn't evidence, we're going to do the clinical trials. We're going to do the preclinical work and not dispense herbs and supplements to patients without safety and efficacy to support that.
Well, it's so important, and we'll get into that again when we start to talk about this research study that was done that was quite fascinating. I As I put these questions together, I always like to partner with my Claude, my LLM, to see what it will dig up for me, and I usually take sort of the best of mine and the best of Claude's. This one was really interesting. It's a little bit of a rabbit hole, but it sort of struck me, and I like it when people can learn something that's impactful to their lives, and it's a little scary too. But you're on the record as flagging that out of the 87,000 chemicals approved since 1970, only a fraction have been tested for a cancer risk. Maybe you could share with us the top three environmental toxins we should be cleaning out of our homes today.
Yeah, so this on the record comes out of a book that I co-wrote with my wife, Allison Jeffries, who's a wellness coach. And we'll get into this more of the areas of lifestyle that you can improve. An environment is listed there within the sixth pillar, and it's probably the most challenging. And we want the quick fix, and to be able to give you the top three allows us some sense of control. But the challenge is, in reality, the risk isn't just associated with one or two toxins. And the biggest challenge is it's this toxic soup that we're living in. And although individual toxins have been tested, and as noted, the minority of them, they've never been tested in combination and for that extended period of time that we're exposed to them. Of course, from conception, which is challenging. So instead of thinking about what are the worst three, I would reframe it where can I reduce my overall burden in a meaningful and most importantly, sustainable way. So we can, take action and really break this into three categories. One of the most insidious are what are called the endocrine disrupting chemicals that are in everyday product. These are things like BPA and phthalates and certain parabens that are found in plastics, food packaging, and personal care products, and reading labels. And the industry knows that we're very upset about this. And of course, there's more awareness of BPA than perhaps of phthalates and parabens. But you'll see on shampoo bottles now that it says paraben free and phthalate free.
Yes, yes, yes.
And so shopping carefully. EWG.org is an incredible resource for listeners to be able to go and look at products that they're purchasing. There's apps now that exist where you can scan the barcode and it'll kind of give you warning. The other area that's often overlooked is what are we consider the indoor air pollutants. And this can actually sometimes be worse than outdoor air pollution, what are called volatile organic compounds, or VOCs, that can come from paint, it can come from cleaning products, it can be off-gassing from hardwood floors. And again, this is something that we have control over. We have control over what we bring into our house. And importantly, in thinking about what you bring into your house, leaving the shoes at the door. Walking around, if you're walking in the garden, down the sidewalk, there are so many different chemicals that are out there. I grew up in Canada. This was just something one did in Canada because for the majority of the year it's pretty slushy and snowy out there. And so we always leave the shoes at the door. I lived in China for an extended period of time, always leaving shoes at the door and having slippers, even for guests, in fact. And then the last area would be, instead of thinking of three products, it's three areas. Pesticides, and this is pesticides, of course, that are on the foods that we eat, and shopping organic, etc. With that said, the benefits of eating fruits and vegetables actually outweigh the risks of not eating them because of fear. So it is very important to make sure you don't avoid out of fear. And again, EWG's got what they call the clean 15 and the dirty dozen. So there are fruits and vegetables that fall under the clean 15 that you don't necessarily need to eat organic, but the dirty dozen you kind of need to.
Well, I'll put that link in the show notes, and I'm now fascinated to go and look at what's on the Dirty Dozen and the Clean 15. So thank you for sharing that. You've just referenced your book, Anti-Cancer Living, Transform Your Life and Health with a Mix of Six. So one, I'm going to ask you about the mix of six in just a second, but I want to get down to one of the areas of it. So you talk about this thing of social support, and I'd love to know, and I think I probably know the answer to this, but why is our tribe or our community just as biologically important as the food we eat when it comes to cancer prevention?
Well, thanks for highlighting that. And most people don't realize that to get healthy, they typically would jump into decreasing calories or improving food, which would be better than just decreasing calories, exercising more, a simple energy balance equation. And people can tend to do that for a short period of time, but then they end up being sabotaged, and they're often sometimes sabotaged by their tribe with all the good intentions that they may have. So social support has both a direct effect and indirect effect. What I just described would be the more indirect effect. They can either sabotage you, hey, let's go out for margaritas and fried chicken, etc., and unhealthy habits. And then, of course, harnessing them for good is really the key, and to have them alongside you to support the lifestyle changes, and in fact to do it together. And when my wife Allison and I started out on this journey of first educating our kids in this area, and then we kind of looked at ourselves and we weren't engaging in, so we engaged our circle of friends and slowly started to change as a group, and that helps to support and reinforce, again, this sort of indirect effects of support to be able to allow you to be successful in behavior change. There is also very strong evidence that social support, and of course the flip side, which is loneliness, impacts all the way down to gene expression pathways, and in particular genes that are in control of immune function, inflammation, and many of the cancer-related processes. And if we think about this evolutionarily, this makes sense. Those who were most connected to other individuals were able to survive a harsh winter, or to be able to defend against predators in the environment. So we have evolutionarily adapted to essentially being in tribe, being in community. And this was selected again all the way down to our genes. And the evidence is the most strong in the area of loneliness, and so much evidence that people who score very high on scales of loneliness have lower immune function, increased inflammation, higher chance of heart disease, earlier mortality. So loneliness kills. And so getting connected is just critical for our health at a biological level, as well as, of course, as I mentioned, being able to engage in what we call the mix of six in a successful, sustainable manner.
It's a great message, and I think it's so important. And I'm not shocked hearing you say that. I hadn't thought about that upfront piece of friends taking you down the wrong path because they're making you do things like eating fried chicken and drinking margaritas. But I can definitely see the anti loneliness piece and just how important the mind body connection is, right? And I think we'll start to talk more about sort of how some of that works in harmony. I was going to ask you a question that talked about your sort of dual professorship at MD Anderson and then in Shanghai and what you've learned from sort of the Eastern oncology practices. I want to get into the research study, but maybe you could just give us. I know you teased us up front with the fact that you mentioned, I think your grandmother was a yoga teacher. And so it started you down the path of like, ooh, there might be some there. But maybe like in 30 seconds, how do you bring these two sort of styles of medicine together? And you're not just like, oh, this is good stuff, but you're going over there and teaching there, and you said you lived in China for a while, so clearly you take this very seriously.
Yeah, so as I mentioned, I was early on kind of exposed to more Indian-based practices, let's say, yoga and Ayurvedic medicine for I think it was at least 15 years, going back and forth to Shanghai Fudan University Cancer Center, where we have collaborative grants studying traditional Chinese medicine for cancer. And the same approach, I guess you could say, is true from Chinese medicine, Tibetan medicine, Ayurvedic medicine from India, Kempo from Japan, traditional Korean medicine, where they are truly practicing an integrative approach. So yes, there is the herbs and supplements and the use in China, Japan, and Korea of acupuncture. But first and foremost, they focus on lifestyle. They'll assess a person's constitution, they'll assess diet, they'll assess their social support, they'll assess their physical activity, their sleep, their mental health. And in fact, it's sort of secondary to start adding the herbs and the supplements because, like we would, they treat the herbs and supplements as potent biologicals that can have side effects, they can have positive effects, they can have negative drug herb interactions, just like a conventional medication. But they're doing this alongside conventional care and being very careful, of course, about safety. In my slide presentations for traditional Chinese medicine, I have this great slide of my colleague, Dr. Meng, who's looking at an X-ray of a patient's tumor at the same time as taking a traditional Chinese medicine pulse. So that's sort of this quintessential example of combining the best of conventional medicine with the best of Eastern practices that have been around for thousands of years.
Well, and thus the name integrative, right? I love the fact that you're bringing them together. And I think you also helped me answer that earlier question of the mix of six that you referred to in your book. So thank you for going through those different areas that people need to pay attention to. And if you do those well, then obviously you have a complete healthy mind body experience, community experience. I do want to get into this research study because it's the reason why we're here today, in addition to the fact that you're a fascinating guy and doing great work in an important area. So, you and some of your esteemed colleagues recently published, I think back in April, a research study titled The Preclinical Effects and Mechanisms of Biofield Therapy on Pancreatic Cancer Cell Growth and Metastasis. Can we start by discussing why this landmark, and I don't say this lightly, landmark preclinical study is so important?
So I appreciate that introduction to the study. This represents at least 4 years of research led by my preclinical colleague, Dr. Pei-Ying Yang. And what preclinical means is research that is done in the laboratory before you move something into humans. So working with cells, working with animals. And biofield therapy is probably the most controversial area within the field of integrative oncology and integrative medicine as a whole. So this is working with another term for this listeners may be familiar with is energy medicine. I don't really like that term because it implies energy is involved, and we're not even actually sure what the mechanism is. But practices like Reiki or healing touch or therapeutic touch, where individuals, through their own consciousness, through their own intention, can have a biological effect on a target. Some people use the word healing, healing another person. To me, healing is the outcome. And so here we were just looking at, is there a biological effect? Could we bring in a human who purportedly does this type of biofield therapy and show that there was an impact on cancer cell behavior, both in a petri dish, and then if we're able to show that, then moving into mouse models. So what we were trying to prove in certainly the initial studies that we did and then continue to replicate over that 4-year period of time is there a there? Is this real? What is kind of reported out there in the field that's more anecdotal in nature. And in fact, there was, and profoundly so. So biofield therapy, we were able to document with incredible replication, numerous times, 3 different therapists, many different ways of measuring cell behavior. And importantly, as we note in the title, the decreased metastatic potential. So in animal models, we were able to show that although the primary tumor shrank a bit, you inject cells into the pancreas of the mice, and then you measure what happens over time when they're getting either biofield therapy or, very importantly, in all our studies, we used what would be called sham or placebo therapy, where everything's the same, all conditions are the same except biofield or no biofield. And substantially reduced metastatic disease to the liver. So within cancer, what leads to early death, of course, is when disease spreads. We're very good at treating cancer when it's isolated to the primary organ. As soon as it spreads, it is much more difficult. So substantial reduction, over 50% reduction in the metastatic disease to the liver in 3 different animal experiments. So we definitely showed, I think for the first time in the most rigorous way, with replication, with controls, that there is a there with biofield therapy.
Well, it leads into my next question, which you've touched on a little bit in this sort of belief of quackery that, acupuncture, when we first started practicing this in the United States, probably 20, 30, 40 years ago, you talked about Reiki, which I know has been controversial. And, acupuncture is now a staple in oncology care. But one of the things I'd love to know, and maybe this is that moment, as a leader in integrative medicine, what do you believe is the tipping point required for the medical establishment to move a therapy from alternative, which I think Biofield is currently considered, to evidence-based clinical guideline? And I think probably the answer is studies like this, right, or preclinical studies that are without a doubt showing improvement and are sort of taking all of the different elements into consideration and really proving beyond a doubt. You mentioned the sham, sort of component of it. And it's like we're stress testing every element of what we could. One of the things I'll include in this, by the way, and I mentioned this to you in our prep up front, is I took the research document and put it into a Google Notebook LM so I could hear the podcast before the podcast. And one of the things they talked about is Well, do the researchers next to the petri dishes, their body heat, does it potentially affect it? It's like, actually, we controlled for that. So I love the fact that you've really
Yeah.
looked around all the corners, but I'll let you answer my original question since I'm
Yeah,
rambling
no,
right now.
and that's and Notebook LM for listeners who haven't used it is a phenomenal way to take extremely complex topics and complex papers and have them simplified. And of course, with AI, we have to double check everything, but it's quite remarkable at the summaries that they can provide. Um, the first step is the preclinical studies. So we're kind of treating this like a conventional drug experiment where you first show that it works in cells, it works in animals. You understand some of the mechanisms. So we have, done cell modification studies and understand what gene is actually the primary gene. There's multiple, but there's one driver in particular that is linked with metastasis and cell migration and invasion. And if you block that gene, Biofield doesn't work as well. If you enhance the gene, Biofield works better. And this is all part of that paper that was published in Cancer Medicine. And what comes next is the clinical trials. So in the absence of a clinical trial, you don't get on the guidelines. In an absence of a clinical trial showing safety, and I don't think there's concern about harm with these types of treatment, but it may not be a good investment of a patient's time and of course money. And once you show safety, efficacy, and it needs to be in large phase 3 clinical trials, is what they're called, which usually involves multiple centers and thousands of people. Then it's on the guidelines. So what's next for us in this area, of course, is doing that clinical trial. And we've presented to the pancreatic team at MD Anderson, and they are really excited to welcome this new therapy in and put it to the test. The randomized placebo-controlled trial is the gold standard, and we're ready. Now, in this field overall, there's been a fair amount of clinical research, but it is subject to concerns with belief and with placebo. And the funders who helped to support this research, the Emerald Gate Charitable Trust, actually have developed a whole series of educational modules for individuals. And they have a podcast coming out that's called Phenomena. There's a documentary, a 4-part series that they've put together in and around this area. And I believe the initial podcast comes out in a couple of weeks for those interested in that at Phenomena healing.com, and you can go much deeper. You can learn about the other research that's going on with some of the other modalities, some of the clinical models for osteoarthritis of the knee and other pain syndromes. So this is the what we really hope is that because we're able to document that there is a there there, that there'll be more openness to doing more research, because that's ultimately going to benefit patients, society as a whole, and move science forward in uncharted areas.
Well, it makes sense. And I'm going to ask you one more serious question, then we have some lighter questions before we wrap up. And I'm going to throw a little bit of a curveball on this because I got some new information last night, which, if you're willing to go down this journey with me. So pancreatic cancer, I think most people know, has a notoriously high mortality rate due to the early metastasis. Given that your research has showed significant reduction in liver metastasis in animal models, what is your vision for how this therapy could realistically be integrated into the treatment journey for patients who feel they've run out of traditional options? And I know you just touched on some of that. My curveball is, I don't know if you've heard of this gentleman from Nebraska named Senator Ben Massey, Ben Sasse, or Sass rather, S-A-S-S-E,
Yeah.
who has pancreatic cancer. He should be dead by all standards now. The cancer has metastasized from his pancreas into all of his other organs. He's on some sort of like clinical trial miracle drug that continues to extend him, although he doesn't have high hopes that's going to bring him too far. But is this something that, could be helping someone like him, heal and do so in a way that maybe past therapies would not have done? And if you can't talk about it, I totally get that
No,
because
I love
we're
to talk.
speculating.
We could spend the whole episode just on Ben Sass, his experience, and that clinical trial. That study and the release of that study was just at the April AACR meeting, the American Academy for Cancer Research. It came out the same day as our paper, so it kind of sucked all the air out of the room relative to our paper. But be that as it may, that drug, Ben Sass, by the way, is he acknowledges publicly he's being treated at MD Anderson on that clinical
Oh,
trial.
great. Oh, great. Yeah.
Um, and what's, it is remarkable. It's the most important step forward for pancreatic cancer. But it's important to note that the control group lived, and of course the study continues, and many people continue to do well. But the interim report is, I believe it was 7 months in the control group and an average of 13 months in the treatment group. So even with these, what are viewed as kind of a grand slam home run for pancreatic cancer, the average life expectancy is still 13 months in the treatment group. There's so much more that we still can do and need to do. What's important about this drug is it's a targeted therapy, and what we see with biofield therapy is also that's a targeted therapy. What that means, instead of hitting somebody with conventional chemotherapy that kind of indiscriminately kills multiple cells in the body, these new targeted therapies are hitting specific mutations, cells that have a specific mutation. Biofield therapy is having an impact on specific cancer-related processes. So the real goal, and I think in the future for biofield therapy is really aligned with integrative oncology. This would be done alongside conventional care. Some work that we published prior to this paper with a different form of biofield therapy showed that biofield therapy has an impact on the tumor microenvironment and changes immune cell infiltration. And one of the challenges with pancreatic cancer is that it has been it's classified as a cold tumor. It's not sensitive to immunotherapy, which is viewed as probably one of the most important achievements in cancer oncology and ever. Turning lethal diseases into pure cures. Pancreatic cancer is not sensitive to immunotherapy. But if biofield therapy has an impact on the tumor microenvironment, could it turn a cold tumor hot? And then if you give immunotherapy, it all of a sudden becomes effective. So I think this is really the excitement that we have in this area is being able to figure out what is the right conventional therapy to combine with biofield therapy to extend length of life.
Well, it's unbelievable. And thank you to you and all your colleagues at MD Anderson that are doing this great work. If you're willing, I do want to do some quick, lighthearted, fun questions.
Sure.
And so the first one is, I'm guessing that even the director of the integrative medicine program must have a vice. What's one food or habit that isn't exactly anti-cancer, but is 100% necessary for your soul?
Well, I don't know if I'd say 100% necessary for my soul, but my big vice is chips and salsa. If I sit down, in a Mexican restaurant or somebody opens a bag of chips and salsa at home, like I don't want chips and salsa in my house. Like, the bag will be empty. So it needs to be a small bag. My wife is very good at filling a small bowl with the amount of chips that she's going
Hmm.
to have, and
Yeah.
I'm not so good at that.
I love to hear that. And salt and vinegar chips might be my similar analog to that. Um, we talked about your book earlier. So, aside from your own, what's one book you've gifted more often than not to friends and colleagues?
So, a book that just aligns with actually our book, Anti-Cancer Living, is and is the bedrock ultimately is Viktor Frankl's book, Man's Search for Meaning. Viktor Frankl is a Viennese psychiatrist who actually had this whole theory, and we won't go into the details of it, called logotherapy, but a meaning-centered therapy. And he had the whole manuscript written out, and then he was captured during World War II and taken to a concentration camp and had to kind of redo the whole book. And then, of course, it became even stronger because how he's able to share how he found meaning and purpose while being in the concentration camp, and saw that it was the prisoners who had meaning and purpose, even in that deepest, darkest situation, were the ones who were able to survive.
Am I remembering correctly? That's the one that he lost the manuscript and essentially recreated it in his
Yeah,
mind
yeah,
while he was there, and then, yeah, I remember reading about that.
exactly.
So great choice. I'll make sure that we link to that in the show notes as well. Next one is, I know you're a big advocate for spending time outdoors. If you could be transported to any natural landscape in the world right now for a quote circadian reset, where would you go?
Uh, well, it's kind of a toss-up, but probably to this island that we go to every summer in Georgian Bay, where it's totally unplugged. But I also have family roots in Florence and just outside in the countryside. But that comes with more baggage. So the Georgian Bay unplug is just that's my happy place. That's what I will visualize as a place to get centered.
Well, it sounds divine. Final question, and I'm really curious to hear who you pick for this. If you could interview any historical figure about their lifestyle habits, who would you want to sit down with for an hour?
Well, it's interesting because, when I first thought about this question, people came to mind like Hippocrates and Mahatma Gandhi and of course Viktor Frankl. Uh, but when I thought more deeply about it, my grandmother actually, Vanda Scaravelli, who I spent a lot of time with. I was in my 30s when she died, and I specifically lived with her in Italy for a year between undergrad and grad school to have her teach me yoga daily for a year, as well as piano because she was a concert pianist as well. But in my 30s, I wasn't doing the biofield work, and her yoga practice was all about energy and connecting to the earth, and she could do remarkable things, not just physically, but I guess more um, things that were hard to define. And I kind of never went there with her into this area of energy medicine and consciousness and concepts of healing, which I know were there, but we never went there. So I'd love the opportunity to be able to ask her these questions about the research that we're doing today, and not just the yoga research, which we've been doing for decades and did while she was alive, but some of this more frontier research. I think she would have a lot to offer.
Well, I don't know if you intended to do this, but we started and ended with your grandmother. I'm sure she would be honored, and what a great way to bring it full circle. And with that, I will say thank you, Lorenzo, for your time today, for doing the hard work, and for trying to make the world a healthier place. And I really love your integrative approach at doing so, both from a medicine perspective as well as just a holistic perspective.
Thank you. Thanks for having me. And those who want to learn more, check out phenomena.com, and we can go on this journey together.
Yeah. Well, like I said, there'll be lots of links in the show notes. So I encourage everyone to check it out. And with that, thank you again.